Good evening to all. I am Dr. Asavri Sawant, Public Health Specialist at IHW Council, and I welcome you all to this exclusive Hypertension Awareness Series, an initiative by Integrated Health and Wellbeing Council powered by Servier. According to the Indian National Family Health Survey 5 of 2019-2021, it is observed that 21% of women and 24% of men suffer from hypertension. It is also seen that 39% of women and 49% of men in India aged 15 years and over are already pre-hypertensive. May is the National Health Awareness Month, recognized every year by the Government of India. May is also the May Measure Month, which is the global campaign by the International Society of Hypertension. Partnering up with Servier and joining the May Measure Month, Integrated Health and Wellbeing Council has organized a month-long initiative to raise awareness on the growing burden of hypertension and to make people aware on the different aspects of hypertension. This live session, we will discuss on the very essential topic of living with hypertension, awareness on the long-term complications and care, for which we have a set of very eminent panelists here with us today. I welcome Dr. Rajiv Garg, who is a senior consultant interventional cardiologist at Aware Gleneagles Global Hospital, Hyderabad. Sir, we welcome you to the show.
Thank you.
We welcome Dr. Vikas Chopra, senior consultant interventional cardiologist at Primus Super Speciality Hospital. Sir, we welcome you to the show.
Yeah, thank you.
We also welcome Dr. Satish Kumar, who is the President of Cardiological Society of India, Jharkhand chapter, and Chairman of Wellmark Hospital. Sir, we welcome you to the show.
Thank you.
We would also like to welcome Dr. Pramod V. Satya, who is the Consultant of Internal Medicine at Manipal Hospitals, Millers Road, Bangalore. Sir, welcome to the show. With all our eminent panelists together, let us start with discussing the first question, which is I would like to ask to all our panelists, which is what are the most common long-term complications of hypertension that you observe in your patients? As hypertension is a lifestyle disease. It is termed as a lifestyle disease because it is prolonging for many years in one's life. So, what are the long-term effects that people with hypertension have been facing? Let us start with Dr. Rajiv, sir.
Yeah. So, as you already briefed about the statistics present in India, almost very well said, 1 in every 3 Indian above the age of 25 is hypertensive. That amounts to almost 29.8% hypertensive population in India. Between the age of 20 to 44, it is more prevalent. We have 3 million deaths due to hypertension, and the control rate of hypertension in Indian population is dismal. It's almost 17.5% only. So it almost means 82% of our population is not having a controlled hypertension, even if they're taking some kind of medication. So now, because of uncontrolled hypertension, they are very liable for complications. The most important complications being stroke. That is, it is one of the most important presentations of uncontrolled hypertension. Then second most important complication is renal disorder. They present with nephropathy and renal failure. Then third most important is they can present with heart failure and myocardial infarction. Then they can also have loss of vision and retinopathy. Then they can have peripheral arterial disease. That's very important. And because of all this, the liability of either having high morbidity or mortality is there with hypertension.
Thank you so much for highlighting that. The same question to Dr. Satish. Sir, what are the long-term complications that you usually see in your patients who have been suffering with hypertension for long term or are getting treatment for hypertension for long? Sir, you are on mute. Yes, please.
Okay, is that addressed to me? I was overhearing. So,
Yes, sir.
Okay.
The question is for everybody that
Okay.
I am
So,
trying to understand. Yes.
as
Belong
Dr.
to the
Garg just enumerated that apart from, hypertension, as it is called, is a silent killer. So it may not be symptomatic initially at all, but you have dreaded complications uh, which are called target organ damage, because it keeps on damaging those organs like kidneys, like heart, like brain, and eyes. So all the end arteries keep on their intima keeps on growing, and they develop in a long run several elements due to that. Particularly important is kidney disease and cardiac disease, apart from, of course, eyes and brain getting involved in form of various strokes, as you sir said. So I think we have unfortunately become in because we are lot of patients are not only hypertensive, but they are diabetics in India. So the kidney disease and heart disease has just starting taking a big toll, and it is coming like an epidemic in our country. So we have to know that, and we have to understand, and we have to educate our people to not only prevent this condition, because not only drugs are the treatment, but there are many modifiable, non-pharmaceutical methods which may help us in, as we will deliberate, or the different panelists will be definitely discussing on it, that there are various ways that we can control, and we have to educate our people about this. So,
Thank you so much, Dr. Satish. Definitely, we will come back on the treatment aspect later on in this discussion. Right
yes.
now, we are trying to understand that due to uncontrolled hypertension or long-term hypertension throughout many years in the life, what all different sort of problems can the person face? So, the same question to Dr. Vikas Chopra. Sir, if you are able to hear us.
Yes, yes, of course, I can hear you.
Sir,
So,
so some of the diseases have been listed by our doctors already. If you can help us understand what real world problems the patient might be experiencing because of this, or the family might be suffering because of this, then that would also be helpful for our viewers to understand.
yes, so as it has been rightly pointed out, hypertension is basically, it is a scourge of the modern times. And in your initial opening monologue, you mentioned that almost one fourth to one third of adult population, and in certain demographics, almost 40% of population is basically suffering from hypertension. So that is a huge number. This is a huge mass of, morbidity which we are confronted with. And unfortunately, like many other diseases, like diabetes, like heart disease, India is also the hypertension capital of the world. So the extent, the magnitude of the problem is immense. There is no doubt about that. Now, why is hypertension important? For that, you have to understand that hypertension basically affects all organs of the body. If you start from the head down to the toe, you start with the nervous system. The hypertension is implicated in, the CVAs, the cerebrovascular accidents. It's implicated in hemorrhagic CVAs. It is implicated in non-hemorrhagic CVAs. The chronic ischemic syndrome strokes in older people has also been known to predispose to dementia. It also leads to deposition of amyloid in the brain cells, amyloidosis, which is also one of the causes of Alzheimer's and other diseases. So, starting from brain, then you come to the heart. Hypertension is probably the number one risk factor for coronary artery disease, and India has an epidemic of coronary artery disease, and one of the main factors is hypertension along with diabetes. Then hypertension is also a cause of congestive cardiac failure in patients who do not have coronary artery disease. Sustained rise in blood pressure, malignant hypertension, accelerated hypertension for a prolonged period can give rise to hypertensive heart disease, which can cause systolic dysfunction, which manifests in the form of low ejection fraction, cardiac failure, or preserved ejection fraction but heart failure, what we call as a diastolic heart failure, because the heart muscle is hypertrophied, it becomes thick. The hypertensive heart disease itself is a risk factor for many diseases, including sudden cardiac death, arrhythmias, and various other morbidities, comorbidities. Then you come down the kidneys. Hypertension is probably the number one cause for chronic kidney disease in India. Most of the dialysis patients are either they have diabetes or hypertension as one of the etiologies, and malignant hypertension can cause acute kidney failure. Then you come down further, and then you have peripheral vascular disease. Many of these patients also have, intermittent claudication, peripheral arterial disease. So there is no organ in the body which is not affected. Now, the question is that, of course, we'll come later on to the treatment, but the magnitude of problem is immense. And as one of the speakers has mentioned in the opening statements, there is a large unmet need for controlling the hypertension, because most of these patients are on some form of therapy, but this therapy is not really effective. Their blood pressure is not optimally controlled, and with various data which we have now, for example the sprint trial, the accord trial, we know that the optimal control of blood pressure is very, very important. So it is a huge problem in India, and it needs absolutely comprehensive approach and deep assessment of the situation.
Thank you so much, Dr. Vikas. Coming on to Dr. Pramod sir, our speakers have been highlighting different aspects. And coming from an internal medicine specialty, I am sure you have key insights to highlight to us on this issue. Can you please share?
Yes, no doubt about that, that hypertension is a huge burden in India, with the increase in the average body weight and the reducing sleep time. The blood pressure epidemic, the hypertension epidemic is slowly increasing. So if they all have listed the cardiovascular complications. Now the non-cardiovascular complications, most importantly, of course, is kidney. Although the renovascular hypertension is very much related to the blood supply to the kidney, hypertension can also affect the kidney by causing nephrosclerosis, tubulointerstitial disease, which are independent of the vascularity. But as the previous speakers highlighted, blood flows to every organ in the body. So no organ is immune to hypertension. Every organ can become progressively damaged because of hypertension. So the long-term complications of hypertension can be related to the hypertension itself, or the end organ damage it produces, or the complications of antihypertensive therapy. So overall, it's a burden for the entire India and for a patient in particular, because hypertension keeps on adding the medicines to your medication list. So over time, patients slowly lose interest in adherence, compliance, and the complication slowly increases. So in the long-term complications of hypertension can involve any organ. But in the present time, when the competitive world, where almost anybody you see, the stress levels are high, the sleep time is less, the sleep wake pattern is being reversed. With all these things, blood pressure, the average blood pressure will be definitely more than before. Also, the present day diagnostic test, the regular health checkup screen where people get treated and diagnosed with hypertension much earlier than before, also contributes to the huge number of hypertension. So I would say hypertension is the biggest burden to Indian population as well as to our doctors, because most of the clinics for an internist becomes filled with hypertensive patients. And also the present day knowledge, the updated knowledge about hypertension is also huge. So with this ever-changing hypertensive knowledge, we need to be updated. We need to educate our patients about all the non-pharmacological and pharmacological ways of diagnosing, treating, and preventing the complications of hypertension.
Thank you so much, sir. With that, we are able to conclude that hypertension in the long run not only affects the heart, but also vital organs in the body, but also has lots of effects on almost every part in the body. So detecting at the right time and seeking a medical help from a medical specialist is very much required. At the same time, let us move on to another aspect, which is, as most of our viewers that are watching come from a non-medical background, so for them to understand in a simpler language, when they hear their doctor saying that you have hypertension, you need to be on this medication, most of them do not understand what is the relation between hypertension and cardiovascular diseases. So for them to understand in a simpler language, Dr. Rajiv, can you please help us explain them the link between hypertension and cardiovascular diseases, and how does it impact each other over the long period?
Yeah. So basically, we should understand the definition of hypertension as by various societies have quoted. It should be a blood pressure above 140/90 measured in an ideal atmosphere. The ideal atmosphere being, nowadays they encourage home BP monitoring or ambulatory BP monitoring. But in a clinic setting, the patient should at least be relaxed for half an hour, which is not possible, but I'm telling you an idealistic situation. Most of the GPs are busy. Patients keep coming in, going out, and you do not have enough time for the patient to relax. So the anxiety itself will elevate the blood pressure by 10/5. So basically, ideal situation is half an hour of relaxation. Patient should abstain himself from smoking and caffeine for at least half an hour to 1 hour. He should be in an upright position. The cuff diameter measuring should be having, which is lacking in our all clinics, including major hospitals, the correct size of cuff. It should enclose 2/3 of the arm diameter. Then tight clothing should not be there. Then it should be at the level of the heart. Otherwise, up and down again will cause this one. So a very obese and a very thin patient with the same BP cuff you're measuring will have a varied blood pressure. This is one. Second, there is in Indians an increased component of sympathetic overactivity. So we are at a stress level or more in which the sympathetic activity is increased. So we have an increased heart rate. The second important factor in blood pressure causation is abnormal RAS system activation, that is renin-angiotensin system activation. So a strong interplay between sympathetic nervous system and renin-angiotensin system imbalance will cause hypertension. So average Indian, the heart rate above 80 is 62% in a study of Jadavitol. Average heart rate in a hypertensive patient is at least 6 beats above the normal. So heart rate is a very important component which is contributing to blood pressure causation. Now, increased heart rate will cause, again, increased atherosclerosis, which will cause endothelial damage, oxidative stress. Then it can also cause ischemia. Then it can cause left ventricular remodeling, as it was alluded by one of the speakers, which will lead in diastolic heart failure. So basically, because of increased blood pressure, the heart has to pump against an increased resistance. The aorta will face the brunt of it, and the diastolic relaxation of the heart is reduced in a cardiac cycle, which will, because of decreased relaxation, you'll have an abnormal hypertrophy. It is just like when an athlete exercises for building up body muscle, but that is good. Here it is detrimental. The heart has to work against increased resistance, because of which it will hypertrophy, and that will cause left ventricular hypertrophy. And again, this is a vicious cycle in which it has to pump blood against an increased resistance in the aorta. So central aortic pressure also will rise. So basically, stimulation of heart for pumping against increased resistance and increased activation of renin-angiotensin system altogether affects cardiovascular system in toto. And because of pumping against increased resistance throughout the body, the work of the heart has increased, and so it tends to fatigue. So initial response will be hypertrophy, then it will start dilating if you don't control it. And then they go into congestive heart failure. So this is how the heart is related for hypertensive patients.
Thank you so much, sir, for explaining all our viewers that. Moving on to the next question for Dr. Vikas Chopra. Sir, we would like to understand how important early detection and management of hypertension is in preventing or reducing the long-term complications, because it is seen as a trend in the Indian society that people do not generally visit their clinicians until the disease has taken a really serious toll on their health. So until they feel proper physical signs or symptoms of any disease, they do not want to seek professional help, and they keep procrastinating and delaying their disease. So how important it is for people to pay attention to this and come for early checkups or regular checkups, because as Dr. Pramod shared, that nowadays hypertension is affecting even the younger population, which is out of normal, which previous years was not common to have an 18-year-old or a 20-year-old have hypertension, but now it is not that rare. So what role does early detection and regular detection checkups play?
So, thank you. This is a very important question. So, as has been pointed out before, hypertension happens to be what we call as a silent killer. So, what are these silent killers? Silent killers are the diseases which do not have significant symptoms in their early stages. For example, we say that diabetes is a silent killer. Similarly, hypertension. Now, when a person has hypertension in the initial stages, there may be no symptom. The person is used to the blood pressure which is there, plus person is carrying on his normal day-to-day activities, and his lifestyle is whatever it is. So what we advise the patients is that beyond a certain age, and now as you pointed out, the younger and younger people are coming up with hypertension. So at any possible opportunity a person gets, one should at least get his blood pressure checked once. Once the blood pressure is checked, once person comes to know that what is the mean level of blood pressure which he has, and if the level appears to be slightly on the higher side, then it is imperative that this blood pressure needs to be rechecked, double checked, and then found out whether it is a spuriously elevated blood pressure, which we call as a white coat hypertension, which happens when a person goes to a doctor or in a hospital setting, and because of stress the blood pressure is curiously elevated. So we need to cross check it, and then once the reading shows that the blood pressure is indeed elevated, then the person needs treatment, because these diseases, hypertension, diabetes, these are diseases which cause their complication over a long term period. These are lifestyle diseases. So if the person has disease for last 5 years, 10 years, it's a painless disease. The person may not be aware that he has hypertension. The effect of sustained elevated blood pressure will keep on happening on the renal arteries, on the coronary arteries, on the carotid arteries, and the deleterious effects will keep on happening. So it is very, very important that the blood pressure is checked frequently. In fact, one of our leading trials, the SPRINT trial, which was published in 3-4 years ago, which was a landmark trial in the sense that it basically proved that the optimal control of blood pressure, which is even lower than what was conventionally believed, does lead to reduction in cardiac events and leads to reduction in mortality. So that was a very important trial. In that trial, what they did was that they had a out of office blood pressure monitoring, in the sense that there was no doctor present when the blood pressure was being monitored. Up to 3 readings were allowed, and then the readings were averaged out and tabulated, and the patient was counseled accordingly. But then whatever it may be, even if the person goes to a doctor and gets, if there's a white coat hypertension effect, much data has shown that even white coat hypertension, which is a spuriously elevated blood pressure, does indeed in fact long term lead to sustained rise in blood pressure. So it's very, very important that the person should be aware that whether the blood pressure is elevated. And if it does turn out to be elevated, then it's very important to start the treatment under the care of a medical professional, and then get frequent medical checkups, because these diseases are lifestyle diseases and they cause their malignant effects after many, many years.
Thank you so much, Dr. Vikas. Coming on to Dr. Satish. Sir, as Dr. Vikas shared that hypertension treatment goes on for long term, for many years, as it is a lifestyle associated disease. So, adherence to the long term hypertension management quite becomes a challenge and has been portrayed by other specialists as well in the same series before. So, can you please touch upon this topic, that what strategies can healthcare professionals employ to improve patient adherence so that long term hypertension management is being taken care of with ease, and considering the potential risk associated with non compliance of medication adherence with patients, that is very common.
Yes, it's a very valid point, and it is important to note that a person who is hypertensive is probably not the only problem or your part that he's having. He might be having diabetes and other cardiovascular diseases, as it is quite expected. So he may be having a lot of pills with him to take on daily basis. So how to, I mean, reduce his problem? As far as adherence to treatment is concerned. So cost of therapy is an important aspect that one has to look into, because these patients are not only on antihypertensives, they might be also on multiple antidiabetics, maybe on statins, as antiplatelets. So all medicines are important and they have to be taken. So it is very important that the cost of therapy, the doctor and the overall, the healthcare personnel have to understand that cost of therapy is one of important aspects that one has to take into account for long-term adherence. Otherwise, many of our patients just will leave some medicines, which may be very important to take. So it is very good that our even Prime Minister's program with Jan Aushadhi and other have come, which are generic medicines, of course, but at least those persons who cannot afford to take costly medicines, they can be suggested to take that, and they're quite okay with it if they continue those medicines at least. Number two, there are various ways of combining medicines, and now polypills concept has also come, and it is being encouraged. Increasingly been accepted by global. Like FDA also. So we can combine medicine. Once the blood pressure gets regular controlled, we can, in some way, we can combine medicine so that pill burden becomes less and less, and that way we can increase adherence because as the number of pills grows, the chances of non-adherence becomes higher. So these are certain methods that we can increase adherence, and of course, health education and is very important, that they should continue. What is the importance of continuing the medications? That is very important. So these are probably the methods that we can increase adherence.
Thank you so much, Dr. Satish. We will come back to this adherence aspect later in the session as well, if time permits. Let us move on to the next question from Dr. Satya. Sir, as we saw, our specialist highlight how hypertension in the long term can affect the cardiovascular health. Earlier, you mentioned that hypertension's one of the main areas that get affected due to hypertension is kidneys as well. So, can you please help us understand how does hypertension impact the kidneys, and what measures can be taken to preserve the renal function or kidney function in patients with prolonged periods of hypertension that are suffering from long term?
Yes. Now we should remember that blood flows in the blood vessels even when we are in our mother's womb. And this blood flow will cause some wear and tear of the small microvasculature. So as long as we live, the blood keeps flowing and there is a microvascular damage because of that. So normally the what we call nephrosclerosis or scarring of the kidney, and a slow fall in the kidney function or the GFR is a normal process of aging. All of us will have a slow decline in GFR as we grow older. Now, all studies have shown that chronic hypertension accelerates this decline in the kidney function. So one of the main aim of diagnosing and treating hypertension is to prevent permanent damage to the kidney. So the kidney can be affected, basically kidney can be affected because it can involve the renal blood vessels, what we call renovascular hypertension, or it can involve the glomeruli, what we call as focal segmental glomerulosclerosis, or it can affect the tubulointerstitium when we call it as a nephrosclerosis. So nephrosclerosis is a broad term in which we say because of hypertension causing ischemic injury, there is a nephron loss. So there is a scarring of the kidney. If say 10% of the kidney is affected, then only 90% of the kidney will be able to filter your blood. So slowly the creatinine, the protein loss keeps on increasing. Now, how different it is compared to the cardiovascular damage. One, the proteinuria is not always proportional to the amount of kidney damage in case of hypertension, unlike in diabetes. Most of the time, the kidney damage often follows a left ventricular hypertrophy. Usually, left ventricular hypertrophy is the most common associated finding in patients with kidney damage. So the long-term, to protect the long-term life of the kidney, it's very important to control the blood pressure levels. Although the latest ASP studies and a lot of the kidney studies, what we call AKAs, all of them show that controlling the blood pressure may not exactly correlate with the decline of the kidney function. So more or less, it is the duration of hypertension that often causes slow progressive nephron loss. Once there is a nephron loss, to compensate this, the glomeruli becomes big, what we call the focal segmental glomerulosclerosis. Also, I would like to highlight that in a lot of hypertensive studies, the kidney disease was shown to be high all over the world in a particular type of gene called apolipoprotein 1 on chromosome 22. This was found in African Americans who had an 8-fold rise in kidney disease compared to the white Caucasians. Now, a lot of studies have shown that these genes have also been isolated from Southeast Asian population. So probably even we, just like the African Americans, have a more higher predilection for decline in kidney function compared to the white Caucasians. So that is why most of the patients we see have some amount of kidney damage or some amount of elevated creatinine, especially people above 65 years of age when they come to us. So kidney decline of the kidney function is a normal process of aging that is accelerated with chronic hypertension. So controlling a hypertension will definitely slow the decline in the kidney function.
Thank you so much, sir. Thank you for explaining us that so nicely. My next question is to Dr. Rajiv. Sir, can you please explain what lifestyle modifications would you recommend or are required for individuals living with hypertension so that they can reduce the risk of these developing complications in the long run?
Yes, it's a very important question to be addressed in the Indian situation. Most important, let us start with our body habits. So most important prevalence in the present day generation is increasing incidence of obesity, which is a measure of body mass index, that is weight by height in meter squares. Average normal body mass index should be anywhere between 23 to 25, depending on whether it's a male or a female. Female, it can be 1 score less. Male, it can be 1 score more. But anything above 25 is called as overweight. And up from 25 to 28, it is overweight. From 28 to 30, grade 1 obesity. 30 to 32, grade 2. And 35 and above is morbid obesity. So most important, every kilo of fat put on increases the work of heart. Almost 700 ml of extra blood has to be pumped per kilo of fat or weight of our body. So the work of heart can be reduced by reducing or attaining an ideal body weight, which can be attained by proper diet, exercise program. Then second most important in Indian scenario is we take a lot of salt. So the intake of pickles, table salt, fried items, then red meat, that is beef, mutton, then country chicken and organ meat should be reduced. Then next most important is you have to control on your fat, saturated fat. So we have a very high tendency for milk products with full cream. So low fat milk should be propagated in the use. Then our diet is very rich in carbohydrates. Almost our diet contains 60% carbohydrates. So if you reduce that 60% carbohydrates to about 40 to 45% and increase your protein content, I think it will be a great way to achieve improvement in your dietary pattern. The next most important thing is we should have inculcate a habit of exercise. So 35 to 40 minutes of simple exercise like walking, cycling, swimming can be of a great help. And in Indian scenario, yoga is picking up with our Prime Minister Modi giving an increased impetus to the program. I think simple yogic exercises for 30 minutes a day can be taking us a great way in controlling our heart rate, our blood circulation, and giving us peace. So attaining simple peace and meditation can relieve the blood pressure to a great extent. Then most important after that is you should inculcate the habit of regular checkups. So patients should visit their physicians at least once in 4 months and get their investigations done for target organ damage as already pointed out. So a simple ECG, echo, urine for protein and serum creatinine with cholesterol and sugar go a long way if you do it on a yearly basis. Then next most important thing what we can do is, as suggested, to reduce the cost of medication, use polypills. So combination of more than one antihypertensive can be used. Okay. And lastly, but most important is avoid smoking and alcohol, which is quite prevalent in younger population and population in general. So I think with these measures, probably we can aim at controlling population better. So be fit, not fat. Use low table salt and reduce your body weight, and inculcate exercise should be your slogan, I think.
Thank you so much, sir, for the very comprehensive, all-rounded answer. With these questions that I am asking, I would very much like everybody's opinions on every question. But as we have limited time for this discussion, I am focusing on different questions for different speakers. The next question is for Dr. Vikas Chopra. Sir, can you please share some insights into the latest advancements that are there in the field of cardiology or interventional cardiology that benefit patients with hypertension in the long term with their complications?
Yes, thank you. That's an important question. Actually, most of the advancements in treatment of hypertension are basically directed towards the medical treatment only. There are various new drugs which are coming up, drugs which are targeting every path of the pathway which basically leads to hypertension. But there are certain interventional modalities which are coming up, which came up about 3-4 years ago, and now they have got a renewed interest. So one of the first, which caught the interest of interventional cardiologists, is basically what we call as a renal artery denervation, RDN. So renal denervation is basically a procedure in which we introduce a catheter into the renal arteries. These are the arteries which supply the kidneys. Because we know that ultimately the renin angiotensin system, which basically modulates the control of blood pressure, originates in the kidneys. Kidneys are the organs which basically provide the hormones for the sustenance of the blood pressure. So these renal arteries are target for intervention in this particular therapy. So in this, we introduce a catheter into the renal arteries, and then we denervate the sympathetic nerves which are found in the walls of these arteries. So these are denervated by using a radio frequency catheter. So these are small catheters, and they are introduced through a guiding catheter, and then we ablate these small sympathetic nerves. So the rationale behind it is that when you take away the sympathetic, the stimulus for the blood pressure, then the blood pressure will fall. Initial one or two studies were not so promising, and because once case control and a randomized trial was done, then initially they found that probably renal denervation is not that effective. But now recent data, which was recently presented in the European Society of Cardiology, and before that the ACC conference, shows that some of these modalities in recent times have shown good results in small randomized controlled trials. So my feeling is that in the coming few years, we will hear more about the renal denervation therapy, and probably it might pick up, because the premise of this is very attractive, that you do the interventional procedure in a patient who has the resistant blood pressure, or who doesn't want to take the so many pills every day, and then you control the blood pressure, and then subsequently follow up the patient medically, maybe totally off his medications. So hopefully in next few years, we will hear a lot about that. So this is the main primary target for interventional cardiologists as far as the treatment of hypertension is concerned. In addition, we have some other procedures which have not gained so much of currency, like baroreceptor, carotid baroreceptor stimulation procedures, arteriovenous fistula formation, and various others. So, but renal denervation remains the most promising, and hopefully we will hear more about it in the years to come. Thank you.
Thank you so much, Dr. Vikas. So as Dr. Rajiv was also highlighting that all these lifestyle changes are required if somebody wants to stay healthy, suffering with hypertension. So my next question is to Dr. Satish. Sir, can you please highlight us what role patient education and empowerment plays for preventing or mitigating the long-term complications of hypertension? Also, can you please help us understand that not just patient education, but also educating the family of the patient when the person is suffering from hypertension for the long term is equally important, as hypertension is a systemic disorder, and they say hypertension and obesity diseases runs in the family. So there is a large chance that if one person in the family is suffering with hypertension because of lifestyle habits, the other family members might also be at a risk for developing hypertension in future. So how does education play a role in this entire process for reducing the risk of hypertension in India?
Yes, this goes without saying that this is of utmost importance, because drug treatment is not the only way to tackle this problem. In fact, any lifestyle diseases, whether it is diabetes, hypertension, dyslipidemia, all have the the strategy has to be multifaceted, and health education becomes one of the cornerstone of the therapy program. So it is very important, because as we have discussed already, that most of the time hypertension is asymptomatic. So it is very important that we have to make them aware that see, the problem may not be occurring today, but it has a very great importance in your in your future and time to come. So that is one. Secondly, we have to also empower them for procedures like measuring their blood pressure at home. We have to teach. We have, even in clinics, we should keep some assistants who can teach them how to measure their blood pressure at home correctly, and we should definitely encourage them to buy one digital, or if possible the regular kind of blood pressure monitor, BP instrument, and to measure them regularly, so that we should also make them aware about the red flag sign when they should come to hospital, like a severe headache, situations like vomiting or severe vertigo, then heaviness in chest or chest pain, shortness of breath, symptoms like these. So they can have, certain what you call hypertensive urgencies. We have to make them aware of these symptoms, so that they can rush to the hospital in time, and we can treat them accordingly. Similarly, we have to also make them aware of certain side effects of certain drugs, because sometimes they are very troublesome, like intractable dry cough associated with ACE inhibitors, like postural hypertension, particularly in elderly, uh, with alpha blockers when we are giving them, and similarly leg swelling associated with calcium channel blocker, particularly amlodipine and other things. So many times they become very nervous out of these symptoms, and we can also teach them accordingly. Uh, it is also important that uh, as we have already discussed many things, that a regular health checkup, whether they are symptomatic or not, is very important. And nowadays, this is the era of information. So many of our patients are already aware from different sources, social media and other things. Sometimes these informations create problem also. Like recently, I went through WhatsApp circulated information that, see, the hypertension and this has been changed. The definition of hypertension has been changed, and different. The criteria for defining hypertension has been changed, and there are many times they are not correct, and people get confused. So we have to, whenever they ask, they whether through different media, and when they come to our clinics, we have to give some time to clear their minds in this regard. So health education, I would say, is a very of utmost importance, whether it can be given by us, the clinicians, or by any healthcare professional. Even one health assistant who is quite aware of these things can be, given time to spare with our patients to make them aware.
Thank you so much, Dr. Satish. And very well pointed out that there are many a lot of information that has been circulated on different applications and on the
Right.
web regarding this thing has changed or some other new drug has come up. And many patients in this era search on Google first their symptoms and
Correct.
then come to doctor later. They would want to get educated by themselves, and they prefer that method. Most of the doctors call them Google patients because they are so much into Google that they start suspecting themselves of having every other disease. But it is, as you rightly said, that clinicians' duty or responsibility to educate them in the right manner, because in the end, what doctors know is their years of learning and skill and their expertise in that subject, which the patients won't be able to get on one answer on Google. So definitely, some little extra time is required with every patient, so that if there are any queries from the patient side or their family member side, so that can be mitigated and the patients can get educated. My next question is to Dr. Pramod Satya, which I would be eventually asking to all our panelists, is that in your experiences, what challenge do patients with hypertension face in the long-term care that you have seen, and how can healthcare providers effectively address those challenges? Starting with Dr. Pramod.
Yes. So hypertensive pharmacological intervention of hypertension is kind of a very customized care. Every tablet suits a different kind of a person. So it's like a horse for the turf. We have to choose the right medicine for the right patient. Otherwise, the blood pressure control also becomes poor and the compliance of the patient also will be poor. So before starting any hypertensive drug, what drug to give, how long to give, All these things depends on how the patient is, depending on the patient age, whether he is old, an old, dementic, frail person may have autonomic dysfunction, just like the other speaker said. A young obese patient may not respond to the usual hypertensive patient. It depends on his kidney function. It depends on whether he has a heart failure, whether it depends whether he's recently had an MI, whether it depends whether he has proteinuria, angina, arrhythmias, and even non-cardiovascular thing, whether a patient has any depression, patient has any gout, all these things, because medication worsens the other comorbid conditions. So in that cases, patient may drop out of the treatment. So an healthcare provider not only educates the patient, but also chooses the right medicine for the patient, because only a right medicine the patient will be compliant with. For example, if patient has a depression, you put him on a beta blocker or a central alpha 2 agonist, their depression can worsen and he'll stop the medication. Some patient is having a very bad sleep disturbances, you put him on a high dose beta blocker in the night, his sleep will worsen. So in that way, to ensure compliance, you have to ensure that you have given the right drug to the right patient. So other than health education, which has to be consistent, it has to be made very clear to the patient that most of the times the medication will continue for life. Commonly, when patient asks how long should I take the patient, I tell them, jab tak jeena chahoge, tab tak le lo. Because there is no option of starting the medicines. And sometimes caring the patient also works to some extent, because especially a patient, maybe especially the younger hypertensives, when they may be traveling, when their sleep pattern changes, when they were traveling to the West Coast in America and their sleep wake pattern may reverse, in which cases they kind of stop the medicines or kind of too ignorant about the dangers of stopping hypertensive medicines. Most of the times when somebody comes with a stroke, either the patient doesn't know that he is a hypertensive or he would have missed the medication. That is why compliance of antihypertensives depends on whether the patient is getting the right drug, and combination regimens, giving as less medicines as possible and in a proper timing which suits the patient. For example, for a working techie, if you ask to take a drug once after lunch, it may not help him. He may often forget it. So to ensure compliance, we have to ensure right drugs at the right time, the minimum number as possible, and what doesn't worsen other problems what the patient has. Only by this education, the patient can be compliant with the antihypertensives all life.
Thank you so much, sir. That was very exhaustive and very insightful. On the same note, to Dr. Rajiv, sir, what would be your inputs on the same question, that what biggest challenges do you face while working with long-term hypertensive patients? And what different treatment options or procedures do you suggest for patients with hypertension who have developed different kinds of complications due to same?
Yeah. So it's a very important thing, and biggest challenge is, first, 90% of the time we do not know the cause of hypertension. It's idiopathic. So most important is, when the first time patient comes to us, we have to rule out secondary hypertension causes which are treatable. So in any hypertension patient arriving at your clinic, you have to do a secondary hypertension workup, which will enable us to choose proper drugs. The most important secondary hypertension causes in India is presence of a renal artery stenosis, presence of Takayasu arteritis, presence of coarctation, which is commonly missed, then presence of endocrine problems, Cushing's, pheochromocytoma, then thyroid disorders. Then we should be very important and vigilant in what drugs the patient is taking. A lot of patients come in middle age with a lot of painkillers. They can cause hypertension and nephropathy. Patients might be on oral contraceptive pills that can cause hypertension. Patient be on nasal decongestants because of allergic problems increasing in prevalence. So you should take a proper drug history to rule out all this. Patient might be on anti-cancer therapy, methotrexates. Then patient might be on anti-inflammatory drugs for rheumatoid arthritis and the steroids. So all these important medications, you should take a proper history. Once having diagnosed, then most important is, as Dr. Satish, Dr. Vikas and Pramod have pointed out, that choose proper drug for a proper person. The most common combinations what are advocated by the international bodies are, if it is less than 40, you can choose a combination of ACE, that is ACE inhibitors or ARB. If they do not get controlled with ACE-ARB, you can add a calcium channel blocker. If it does not get controlled with that, add a diuretic. Then if the patient is having resistant hypertension, which is defined as when the drug, more than 3 drugs, including one of them is a diuretic, does not get controlled, it's a resistant hypertension, we might have to add mineralocorticoid receptor antagonist. And if the conditions are various, they have disease specific, like if the patient has congestive heart failure, myocardial infarction, you can add a beta blocker. Then if your patient is having uric acid hyperuricemia, the drug of choice will be losartan. If the patient is having associated peripheral arterial disease, you might add diltiazem. So few specific drugs according to specific indications, but most commonly the formula is less than 40 ACE-ARB, more than 40 calcium channel blockers. If it is not controlled with either, do a combination and then add a diuretic. Then most important, once you have some secondary hypertension which are treatable, like renal artery stenosis, we can consider renal artery stenting if the kidneys are viable. So first you should see the viability. It should not be small contracted kidney. Should have documented evidence that the stenting will help him. So basically, we have seen patients presenting with flash pulmonary edema, and you've done coronaries, you've done renal angiogram, everything seems to be normal. But just go down slightly, you might have a bilateral renal artery stenosis. So that is a treatable cause. Then in India, females, you might have a disease called as Takayashu arthritis, in which renal arteries, subclavian arteries, aorta is involved. So you might have blood pressure, and it can be corrected by interventions along with drugs. Then you can have a coarctation of aorta, which is missed on a clinical examination. Radiofemoral delay, you should see clinically, and a murmur interscapular region. And on the echo, you can confirm the diagnosis with echo and MRI, CT scan. So they are all treatable causes. Then the complications of hypertension can lead to coronary artery disease, where we might have coronary artery disease, and this should be treated by interventions, as rightly pointed out, coronary artery stenting and various measures. So I think this is what, in short, we can go. We do have interventions for renal artery stenosis, coarctation, Takayashu arthritis, and as rightly pointed out, renal denervation is questionable because Simplicity 3 trial, a lot of trials that showed that it was not valuable, but probably it was not properly done. So if you do renal denervation properly, probably it might be an answer for resistant hypertension and people who do not want drugs.
Thank you so much, Dr. Rajiv. Listening to you reminded me of my pharmacology professor, and you were definitely better than her. So thank you so much for summarizing all the different aspects in such quick time. Moving on to Dr. Vikas, sir, building on to some of the procedures that Dr. Rajiv were mentioning, what are the biggest challenges do you feel in your practice for managing people which have long-term hypertensive complications already? And what are your thoughts around this?
So, the very exhaustive review by Dr. Rajiv, obviously, so he's covered everything. The biggest challenge, of course, being a lifestyle disease and being a disease where you have to change your whole life around it. The biggest challenge comes that the patients are reluctant to follow throughout their life. So the patient may start off with the adequate treatment, all the medicines you are saying, we are telling them they come for regular follow-ups, get their blood pressure checked, get their biochemistry checked routinely. But then we find that after a few months, maybe after 1 or 2 years, the patient loses interest. This is the commonest problem in India. Now, this can be because of various reasons. This could be financial. The patient is not very keen on spending money again and again on the same things. He may feel that I did the serum biochemistry tests last year. Why should I get it repeated now? Why should I get an echo? Why should I get a treadmill test? Why should I get a renal artery Doppler? So these are things, which are basically, prevent a patient from following through. Other than that, the patient may come to hospital. Patient may, the hospital is in a hurry. There's a lot of crowd. The patient may not get his blood pressure checked properly, and the blood pressure is high. It is not optimally controlled. Can be missed. So the patient loses out on that. So the idea is basically to counsel. I think the idea of having specific special blood pressure hypertension clinics in busy hospitals is a very good idea, where the whole focus is on managing hypertension, not on managing congestive cardiac failure, not on managing CAD post-intervention patients. So a specific time slot can be kept for these kind of patients, and a nurse educator or some kind of a coordinator can be assigned who can counsel the patients, regarding their medical therapy and other things. As far as the drugs are concerned, Dr. Rajiv has already mentioned they're very tried and tested. We have very, very effective drugs. The consensus these days is basically to start maybe two drugs at the same time, not the full doses, but moderate doses or small doses. And the fixed dose combinations of two moderate doses of two molecules is a way to go, because reduces the number of pills. And as mentioned, the combination of an ARB or an ACE inhibitor along with a calcium channel blocker like amlodipine is usually the first choice of drug combination which we prescribe. And of course, then you have specific indications for which you can have specific treatment. Patient is having CAD, patient is having arrhythmias, patient is having atrial fibrillation. So all these things, you can tailor the drug treatment accordingly. But we have that said and done, we have very effective drugs for the treatment. Another one important factor which I find in my practice is the salt intake in these patients, because as one speaker has previously mentioned, sometimes we keep on enhancing the drugs, and we find that the blood pressure is not coming down, and the patient denies taking any other medication. He says that he is taking his drugs, but then we find out that he's taking some these salty product, he's taking, consuming achar or papad or other things. So it's important to counsel the patient, especially in salt sensitive individuals. So these are some of the points which I wanted to mention.
Thank you so much, Dr. Vikas. As we are very short on time, let us take the last question from all the panelists, which is key takeaways. So as we conclude today the entire month-long May Measure Month initiative for hypertension awareness, what would be the key takeaways from all our panelists regarding timely measurement and hypertension control? So starting with Dr. Vikas, as we were continuing with him.
So the key takeaway is that hypertension is a killer. It's a killer disease, and the extent of morbidity in India is enormous. We have the largest number of patients with hypertension probably outside of China in India. And it is a disease which causes long-term damage to practically every organ of the body. So idea is to educate the people, educate the patients that this is not a disease to be taken lightly. Take your treatment and keep a check on your blood pressure, get a proper documentation of your target organ function, and keep on following up with the doctor on a regular basis.
Thank you so much. Dr. Rajiv, what would be your key takeaways very quickly, sir?
Yeah. So about 25 yearly checkup for hypertension, any blood pressure above 140/90 if you are not a diabetic hypertensive, and 130/80 if you are a hypertensive diabetic as a goal of hypertension. Then most important is adhere to treatment, then lifestyle modification, which should be attain proper BMI, less salt intake, and yearly follow-up for target organ damage should be a basic treatment apart from getting worked up for secondary hypertension.
Thank you so much, sir. Dr. Satish, sir, your key takeaways.
Yes, it is very important that we have to learn that apart from medicines, we have other measures of tackling this problem. And today being no tobacco, World No Tobacco Day, 31st of May. So this is one of the big no-no for hypertensive patients. If you are taking tobacco in any form, whether you are smoking, you are taking chewable tobacco like honey, which is very common in my part of geography. So these are big no-no. Alcohol reduction, moderation has a big role to play. Then very peculiar problem with us is what is called mixopathy in India. that we have not touched upon, because many of times what we will see that before taking medicine, or they know that they are hypertensive, they will keep on taking drumstick juices or whatnot, therapy. So, and then once they realize that it is not getting controlled, or they have some kind of complication out of that, they will come to the clinic properly. And so this is one problem, and it is our, in fact, responsibility to make them aware that, see, this is very important, that this disease has to be treated and properly controlled from very beginning, for very early. Not once you get some kind of target organ damage, or once you start having symptoms of heart failure. So again, I will give all impetus on the health education part. So that is very important.
Thank you, Dr. Satish. Dr. Pramod, sir, your key takeaways.
So basically, as the other speaker said, people about 25 don't ignore subtle high diastolic pressures. If somebody has a diastolic pressure of 94, 96, they often ignore it. So don't ignore that. And the most challenging, we are basically a product of our genes and lifestyle. So how long we are going to live depends on our genes and our lifestyle. So exercise, sleep, reduce body weight, moderate alcohol, reduce smoking, and have a strict disciplined lifestyle. In these days, stress management, either in the forming having a good quality sleep or meditation, all of us have a different way of handling our stress. Sleep is very important in nowadays to treat a variety of diseases. Most studies shows that the delta wave sleep, which produces a lot of serotonin and noradrenaline, have a big impact on the baseline blood sugars, hypertension, migraine headaches, irritable bowel. So sleep well, exercise well, keep your body weight to a lower level, undergo regular health checkups. With that, you will ultimately, compared to all other comorbidities, hypertension produces least symptoms. So don't ignore subtle high blood pressures.
Thank you so much. With that, we wrap up this very insightful session on living with hypertension, awareness on the long-term complications and care. I would like to thank Dr. Rajiv Garg, Dr. Vikas Chopra, Dr. Satish Kumar, and Dr. Pramod V. Satya for taking out time from their busy schedule and imparting with us the wealth of knowledge and information. Thank you so much. I would also like to thank our partner, Servier, for this month-long hypertension awareness initiative and for spreading awareness on this topic. Thank you so much. I would also like to thank all our viewers for staying with us till the very end. With that, we sign off now. Stay happy, stay healthy. Thank you.
Thank you, Dr.